The Hard Truth, Season 9 with Akosua Konadu. Proudly brought to you by EcoBank.
We talk politics, economy, business, and development, and yet in all this, it is the health of the people which matters most. Without a healthy generation, nothing else matters. So today, we want to take a closer look at health challenges of the younger generation on The Hard Truth. What health challenges are we overlooking, and is there a real solution? Dr. Gordon Attoh is my guest, and he's a doctor at the Pentecost Hospital. My name is Nana Akosua Konadu, and this is The Hard Truth, and it's proudly brought to you by EcoBank, the Pan-African Bank. It's a health talk tonight, and Dr. Gordon Attoh, medical officer or doctor for the Pentecost Hospital in Medina, Accra. Doctor, welcome to The Hard Truth.
Thank you.
You look
Thank
well.
You.
First time in the show. Short notice, but thank you so much for your time.
You're welcome.
Right, you realize that Ghana has a life expectancy of about 65.7, that's in 2014, and up from 57.42% in 2000. This indicates an improvement in the quality of healthcare in Ghana. But however, many diseases are becoming prevalent in Ghana, most worrying, in fact, that many Ghanaians have now been dying of at a younger ages. What do you think account for these things?
Well, thank you very much. I think there are multiple factors that account for this. Let me say that in time past, most Ghanaians were dying from 5 killer child diseases. So you see that most children don't get to 5 years and they die. Those that survive after 5 years were dying mostly from infections and then nutritional problems. By then we were not getting much to eat. The poverty was so high and endemic. But now with improvement in life, most people are eating well. Infections are not killing many people. But what is killing most people nowadays is, we term them disease of the affluent, disease of the rich. So many people are getting diseases from overnourishment.
Overnourishment?
Yes.
Yeah.
From obesity. People are becoming too big, and it comes with its own problems. Quite a number of people too are dying from hypertension and its related disorders.
No, but I get that. But if you look at the statistics, should that be 65%? That's an improvement. Why should we leave to 57 or something like that, or 67? That's expectancy in Ghana. Isn't that too small a number?
No. What it means is that on the average, we should be dying, or most Ghanaians are dying at the age of 67 years. From down from 57 to about 67, which is an improvement, like you indicated. In some countries, they are doing over 80s. In Asia, Japan, for instance, they have over 90 life expectancy.
Why can't it happen here? 67%?
Well, it can, but it will take some time. And we are improving, just like you said.
What's happening? Because in the olden days, someone can live up to 80, 90, even 100. My grandfather was a 104 before he died. But now, as young as 30, off, 28, off, 50.
Yes, but the question you need to ask is, how many of the people lived up to 104? Just a few, 1 or 2. So we are getting most of our people living over 60 years, which is quite good. However, some lifestyle problems means that some of us are going to die quite early. And it's a problem because that can be improved.
It's scary. I mean, it's like you are scaring Ghana now. So what is it?
I think most of us are dying from diseases we acquire from the food we eat and the lifestyle we adopt. Quite a number of young Ghanaians are taking to alcoholism. They are drinking much more than before. In time past, there was nothing like drug abuse. People were not using hard drugs. But it's so common in our time that people would do anything to get access to these hard drugs. And these things are contributing a lot to the deaths of the young people. Quite apart from that, in time past, we were eating very good food. But now most of the food we are eating can be classified as junk foods. And as you build them up in your system, they create a whole lot of problems. So until we move away from some of these things and adopt very good lifestyles, I'm afraid we'll be seeing this trend for some time.
You know, obesity in developing countries is quite growing, and it's becoming an alarming problem. I mean, everywhere. Twice as many people in developing countries are overweight and obese, and according to the research done ODI in 2008, it says that current trends with increase in the number of people suffering from cancer, diabetes, strokes, and heart attacks. I mean, why is obesity becoming a problem to the world now?
Yes, it's becoming a problem because we have too much to eat. In time past, they didn't have much, so people were getting problems of malnutrition. Now there is abundance, and we are moving into problems with overfeeding, and that is where obesity comes in. Secondly, in time past, we didn't have very good roads. We didn't have most of journeys we made were made by foot, and that was a form of exercise. Now we can just sit in a plane and move around. You sit in cars. People virtually do very little. In time past, there was no air condition, so people.
That's bad.
It wasn't that bad.
No, I mean, is it bad to
yes,
air
because you're sitting, you don't sweat, you don't burn the energies. All the food you eat is converted into calories, but because you don't burn it, it is stored as fat in your body. And that is where we get these problems of obesity from. You put on weight within a short time, and it has become very difficult for you to even reduce weight. People take to exercise, they try to do so much. You've realized that it's so difficult to lose weight than to gain weight.
What can be done to increase the number from 67 to, say, 80?
A lot can be done. First of all, we must change our lifestyle. We must eat well. Secondly, we must exercise. I think it is very, very important. And then rest.
Isn't exercise, I mean, I heard this story and I'm like, so why the need to go to the gym? A young man went to the gym, he exercised so well, he got home and died.
Probably.
And died.
Probably. He may have developed heart disease. Okay. So at that point, when you exercise without supervision, you may develop complications. Okay. So we can have supervised exercises.
So do we need to seek medical attention before or prior to going to the gym? Do we have to come to a doctor? Dr. Attoh, I want to go to the gym. Do I need some checks before perhaps it's in the gym?
Yes, I think that is most advised. But then, as a routine, we should have regular checkups. We should have, so that you know your history. And then before you go to the gym.
I would like to talk about the checkups after the break, and we'll be right back. Please stay on. This is The Hard Truth.
The Hard Truth, Season 9 with Akosua Konadu. Proudly brought to you by EcoBank.
EcoBank, we see a great future, one that's full of opportunity for those who want to be the best. With over 1,000 branches of a single bank across 33 African countries, it's a future where trade can flourish without boundaries. The future is breathtaking, with enormous cross-border investments helping business and government build new infrastructure, while individuals achieve their ambitions right across Africa. The future is Pan-African, and EcoBank is the Pan-African Bank.
Welcome back, and you're still watching The Hard Truth, proudly brought to you by EcoBank, the Pan-African Bank, and we're still talking health. And Dr. Attoh, medical doctor for the Pentecost Hospital here in Medina, is here. You were talking about medical checks before the break. What should I say when I go to the what check? What am I going to check for? I should just say that I'm coming for a general medical checkup.
First of all, in Ghana, the concept of family physician is not so common. But under normal circumstance, every family must have a family physician. So right from your birth, there's somebody that follows you. We know your history and all. So as you grow, we track your health status. And it's very easy for the doctor to do checkups because the doctor has almost every information they need.
You, right?
Yes. But if you don't have such experience, when you go to the hospital, you need to tell the doctor that you are coming for checkups. The doctor would ask you questions right from the period you were born, the experiences, your medical experiences.
Do you say that? You're in a hurry, you have about 1,000 patients to attend to. So I come to the hospital and then, yes, what do you want? I want to do medical checkup. Which checks? So you actually ask them the checks they want to do. And then if I don't know, then...
That is not the normal practice, okay? That's not the normal practice.
So why don't you practice that then?
Well, I don't know, because before I even do a test on you, I need to know your history. That is what will guide me to do whatever test I need to do. Of course, no one can do all the checks in the body at a time. So you talk to the person, you find out the risk of the person, and then that is what will help you or guide you to do some basic tests. Then following that, you can go to more complex tests depending on what you find. Okay, so medical screening is quite a broad thing to do.
So what would you look out for generally? So when I come, I'm coming for a general medical checkup to look. What do you want to see?
Well, your age is one factor which will tell me. It tells a lot about the risks associated to your age group. I need to know your weight, your height, to give me an idea of your body mass index. I need to also know your blood pressure. I need to know your pulse rate, the rhythm and all about it, your temperature. When I finish, I need to now physically know about your physical examination, check your cardiovascular system, check your respiratory system, your gastrointestinal system, your skeletal system. There's a whole lot you can do. Then when I'm done, from the physical findings, it will help me find out about certain laboratory tests I need to conduct. Of course, I need to know how much blood you have, your hemoglobin level. I need to know your platelet level. I need to know your white cell count, after which I may need to know your fasting blood sugar, depending on your age. If it's a young person, there's no family history of diabetes, you may want to skip, but it's very important you know. You need to know the person's cholesterol level. You need to know how the liver is functioning from the laboratory tests, how the kidneys are functioning, and the whole lot. So all these things inform us the way we should go.
So it's very necessary you do your general
Very
checkup at
necessary.
least once a year.
Once a year, at least.
Now, since you lecture at the Central University, I want to ask, you find out young people, are introduced to alcohol at a very tender age, and you just want to ask the question, why, in your opinion, since you have, a personal one-on-one relations with the young people, what do you think accounts for these factors?
Well, I can say, number one, you have pressure from peers. I remember when we were young, and still do, I think the advert is still there, that alcoholic beverages are not sold to people under 18 years. I wonder how many of those outlets that sell those beverages are even bother to know the ages of people coming to buy these alcoholic beverages. Besides that, the advert is there, very, very catching and tempting. And most young people would want to at least experiment.
Right.
So
they become addicted.
Yes.
So I want to ask,
early.
how do you overcome the addiction? How do you do that?
Well, it's not easy. When you get to the level of addiction, it's not easy. You need to go through a whole lot of program, including psychology, and there's a program that you need to go through. And you, the person, must be determined that you want to overcome the addiction. If that determination is not there, I'm afraid you may not be able to overcome.
So I'm sure parents,
yes.
Guardians,
yes,
will have
family
to do
members, friends, and all these people need to come in to help you overcome the addiction. So it's a multidisciplinary approach, and it doesn't only take the medical persons. Your family is there, your subordinates at work, your friends, all these people need to come on board to help you overcome this addiction. So it's not a very easy thing to.
Let's look at the report, the WHO report in 2014 that reviewed 12,000 people of Ghanaians, dying of cancer each year. And then some scientists of the view that the restrictions on alcohol and sugar need to be considered. What's your take on this finding?
I think I share in that opinion. Alcohol is a very bad. We call it it's a drug. Yes. So it's a very bad drug, and if you can avoid alcohol, I think it's better. We need to check the weight. And obesity is not only in the adults. These days we are getting childhood obesities, which is becoming a very big problem. Children are no longer exercising.
No, we have PE in a what's it called, in our education settings, so it's assumed that they have some form of exercise in school.
Just visit the schools and find out how many schools even have a football field or a pitch where the children can play. It is non-existent now. So most of the children do not take to exercise, and they become obese. And you see a young person, very fat. So obesity is a problem. Childhood obesity is one of the things. So it starts right from childhood, and then as you grow into your teens, into your early adulthood life, most of the damage has been done already. That's why you find them dying that young, 20 years, 30 years, as you mentioned earlier on, because it was right from the beginning.
We'll be right back.
The Hard Truth, Season 9 with Akosua Konadu. Proudly brought to you by EcoBank.
At EcoBank, we see a great future. One that's full of opportunity for those who want to be the best. With over 1,000 branches of a single bank across 33 African countries. It's a future where trade can flourish without boundaries. The future is breathtaking, with enormous cross-border investments helping business and government build new infrastructure, while individuals achieve their ambitions right across Africa. The future is Pan-African, and EcoBank is the Pan-African bank.
We are moving from the politics and from issues of the economy, and we are talking health today. What can we all do to keep healthy and attain that age God promised us? 80, 90, 100. Dr. Attoh, he's a medical doctor of the Pentecost Hospital. He's my guest. Doc, I need to understand this. We're talking about cancer before the break. Cancer treatments are so expensive. Why is that?
It's not easy to treat cancer, and the treatment is done in stages. And the best thing is to prevent the development of the cancer. But when you get the cancer, now the next thing we need to think about is at what stage is the cancer, because that determines the level of treatment.
In fact,
yes.
How will I know, apart from breast cancer? I mean, you ask to lie down and then massage and see if there are lumps. What of other cancers. How do you determine that I have this type of cancer?
Well, some of them run in the families, and some come as a result of exposure to certain chemicals and certain drugs. Some also come as a result of infection to some viruses and germs. So the history tells it, and there are signs that give rise, you see when you start developing some of these things. Even though initially it may not be very, it may not show forth easily, but then there are ways we determine it. So like we all do from the onset, it's your history and then the examination findings, and then we go into the details of finding out what type of cancer.
Is there any detection, simple detections to know that I have cancer, or I have this, other disease?
You see, most of the cancers we have are not visible to the eye. Okay? It is only perhaps skin cancer that you see the changes on your skin.
What
and
would
say,
you see?
Yes. Most of the cancers, for example, cancer of the cervix or cancer of the throat, cancer of the... You may not find anything physical. The person may come complaining, let's say, I'm bleeding too much, or after sexual intercourse, I see blood, which didn't happen. Then you begin to ask yourself, what is going on? You want to go and look at the cervix, and you see that the cervix is ulcerated, and you take sample to the lab, and it confirms as cervical cancer. Cancer of the breast, most of the time is painless. It starts like a small lump, and it develops over time. So somebody that doesn't frequently examine the breast may be there, and it will be growing until it becomes a very big mass in the a big lump in the breast. Then it becomes noticeable. Even at that stage, the person may not even take it serious because it doesn't hurt, it doesn't come up with any problems. Then they realize that the breast is becoming sore. Then they come to the hospital. At that time, it is late.
Let's talk about heart diseases. It's, you realize that it was so common with the elderly people or older people, but now it's come to stay with younger people. Many factors, hereditary, it could be lifestyle. I'm asking the risk factors, involving that. What can we do to just take these things away from the younger people?
Yes, we can delay the onset of cardiovascular diseases, even if we have a positive family history. Let's say my granddad had hypertension, my dad had also got hypertension. It's running through the family. I'm likely to develop hypertension, but I can delay the onset, and then I can also delay the severity of the disease by adopting very good lifestyles. In that case, I need to exercise at an early age.
But some parents won't tell you that I have this. They don't want to bother or worry anyone, so they just keep it, so you wouldn't know.
Well, you see, at least you see daddy or mommy taking medicines every day. And then you'll be curious to know, why is mommy swallowing all these tablets, or why is daddy taking these medications? We are becoming enlightened. And parents must also understand that some of these things are hereditary. So once you have it, your children could be at risk. So you start educating them early so that they start the preventive aspect.
So adopting
early.
a very good lifestyle really can reduce it. I
Yes.
want to talk about unprescribed medication. It's so common to see uncertified people selling different kinds of medicine, including herbal concoctions in vehicles on the market. What are the implications of the situation to the safety of the general public, in your opinion?
Well, it is very harmful and dangerous. Some of these things can predispose you to all the things we are talking about. That is one. So again, these unprescribed, bear in mind that every drug is a potential poison. So as
every drug
yes,
is a potential poison.
That is why it has side effects. We have beneficial effects of the medicine and then side effects. So if you don't go through the specified or through a doctor to check all these things and you keep going for it, then you are taking this thing beyond the limit you need to take it, and it will give problems.
Do we have to self-medicate?
Most of these medications that are sold over the counter that we often use in our homes, most of the time it is written on it. When you take them for 3 days and you are not getting better, or it recurs, see a physician. That aspect of the instructions, most of us turn a blind eye to it. If you are doing self-medication, 1 day, 2 day, and the problem is still there, you need to see a doctor. Yes.
You've said a lot today. For people watching out there now, what are the simplest things to resonate in our minds? What can we do to keep healthy as a nation? Simple steps.
Number one, eat well. When I say eat well, eat at the right time. Eat the right kind of food, prepared under the right conditions. And then number two, exercise. It's very important. Nothing can replace exercise. We need to exercise the body to keep fit, to keep our system working well. Number three, you need to drink a lot. Water is good for the body. Number four, have a regular checkup. Number five, rest. Rest is also very, very, very important. We need to rest. And then have very good social network. I think when you have good friends, you enjoy your life. You live healthily. Your family support, friends support, all these things are very important. So these are basic things we must all keep in mind and follow through, and it's going to help us a lot.
Dr. Attoh, thank you so much for talking
Welcome.
to the heart. So you heard him: exercise, eat well, and eat under the right conditions. Eat good food, vegetables, fruits. What else? A lot. He said
drink
tonight.
a lot.
Drink a lot of water.
Have regular checkups.
Exercises, checkups,
and
maybe
rest.
more. Rest. So we all have to keep healthy. 67 or 65 is not so good. At least by the end of the year, when the research is done, we should hit 75 or 80%. My name is Nana Akosua Konadu. If you want to have a one-on-one conversation with doctor, you can call 0244 668573, or you can visit the Pentecost Hospital at the Medina Estate here in Accra. My name is Nana Akosua Konadu, and the show is proudly brought to you by EcoBank, the Pan-African Bank. Have a good evening.
The Hard Truth, Season 9 with Akosua Konadu. Proudly brought to you by EcoBank.